58 47. Almirad Tiles, now open.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
दोस्ता की परेशान है
जरा कर है ना सारा सौदा मुक्या वा मुल्का विच पैसे भेजने
हूं नहीं मार फूड वाले की फोन खड़का ते फ्री लोकल डिलीवरी कार मंगवा
अलाता उठा क्या स्पेशल आ
उना की लबाई हाइजीनिक ग्रेड 5 चीजें चंगियां मियारी ते सस्तियां ते नाले ऑफर ही ऑफर
और क्या
ताजा गोश्त ताजी सब्जियां ते फ्रूट आटा चावल दालां मसाले ते जूस सारे बिल जमा करने गैस ते इलेक्ट्रिक ने टॉप अप भी करने पाकिस्तान पैसे बिल्कुल फ्री भेजने मतलब के एक चिड़ी ने दूध छड़ी ता हर शय लबनी
उठ जने ने आप उतरा
Amar Food Store and Halal Meat 613B Lincoln Road Peterborough telephone 01733 687374.
One of the most notable women who took part in the Battle of Uhud was Nusayba bint Ka'b. She stood firm with the Prophet, peace be upon him, acting as a human shield to protect him.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum. This is Dr Shabina Asad Qayyum for the Body, Health and Mind show on Salam Radio 106.2 FM. My goodness, it seems as if I haven't been here for ages. I couldn't wait to come back on such a wonderful day as well. Isn't it such fabulous weather? I think it's been a welcome change to the weather, where you've all been complaining about the hot weather over the last summer, and then the cold kicks in, and you've all decided to put your heating on, and now we get this wonderful, beautiful spell of warmth all of a sudden that's enveloping us and reminding us of how grateful we should actually be for the blessings that Allah subhanahu wa ta'ala gives us. So absolutely wonderful to be back with you, my wonderful listeners, my wonderful brothers and sisters. To all of you from all faiths, all communities, we are Salam Radio 106.2 FM in Peterborough, the station, the community radio station that aims to build bridges with people of all communities, all faiths, and it's a privilege to be here. Now, it's been a while since I came and broadcasted. Had a bit of a gap last week, but this week we've got a wonderful guest who I'm shortly going to be introducing. But in the meantime, I hope you've all kept well, and just to make you aware that you can be in touch with us by ringing if you want to ask any questions on the studio telephone number, which is 01733 602 133, or you can WhatsApp or text us on asking any questions, whatever you want to, on 07745 278 978. Alternatively, we are on Facebook Live, Instagram Live, Twitter Live and YouTube Live. Well, fancy that. I usually get quite a lot of questions that come through on Facebook Live, but without further ado, I'm going to introduce my wonderful guest now. I have an ENT consultant who is the training program director in East Anglia in ENT. He's also a consultant ear, nose, throat surgeon at the Northwest Anglia Foundation Trust, which comprises of quite a few hospitals. So we've got Peterborough City Hospital, Hinchingbrook Hospital, Stamford Hospital as well. And his name is Mr Asad Qayyum. Assalamu alaikum.
Wa alaikum assalam. Thank you for having me on your show, Shabina.
It's wonderful for you to take your time out of your very, very busy schedule to come and join us here today. We're very thankful to you.
Most welcome.
So how has your day been today in ear, nose, throat, the ear, nose, throat department?
Very busy. As you can see, I just made it 30 seconds before you started.
Yes, that's right. That's right. And obviously, I'm very much aware of the work that you do and the fact that you've become the training program director, which is wonderful. I know that that took place a short while back. So congratulations from all of us here at Salam Radio.
Thank you very much. I'll be starting that officially. I'll be starting my new role as of next week.
Wonderful. And what does that entail, Mr. Qayyum?
That entails training the next generation of ENT surgeons.
Okay.
And that will be happening. So that basically involves all the trainees who are training to be ear, nose and throat consultants of future
Right.
within the east of England, I'm supposed to ensure that the training is of a standard. Sorry, I need to pull it closer. Okay. So to ensure that their training is of a adequate standard, to ensure that there is no compromise on quality, and they're safe to be signed off as future ENT surgeons.
That's wonderful. And something of great responsibility, I can imagine.
I'm sure. It's always there. Responsibility is always there.
You know, with ear, nose, throat surgery, I've got a background of ear, nose, throat surgery as well. And I've always liked it. I've thought of it as one of the more laid-back surgical specialities, but actually, if you look at it, it's one of the most challenging specialities because you deal with all the airway problems, don't you?
You do.
So any child that's choking, for example, or an adult, for example, that would go to your department. So you literally have minutes to seconds to make life-changing decisions to save a patient's life, isn't it?
That is indeed correct. The opportunity, the window period for reversing situation is a very, very short one. And sometimes those few minutes are the golden minutes where things can be reversed and improved.
So extremely wonderful job that you're doing, and thank you very much for all the services that you are contributing to within the NHS. You're a valuable asset to
Very
the community.
kind of you, thank you.
You're welcome. Now, moving on, I thought that we would talk a little bit about general ear, nose, throat problems. In the position of responsibility that you had, one thing that I thought I would talk about is a little bit of tonsillitis and then go on to ear problems. Being an ear, nose, throat surgeon, would you like to talk a little bit about what tonsillitis is, what the tonsils are, what tonsillitis is, and how it develops and can infect children, adults alike?
So tonsils are two almond-sized glands present on the side walls of the throat. And if we ask little children to open their mouth, they're these almond-sized structures and almond-shaped structures sticking out from the side wall of the throat that a parent can usually view. If the child starts to get infection, or if they start to get fever, along with soreness of the throat, and the individual and the parents can see whitish spots on the tonsils, that is classified as tonsillitis.
Right.
And tonsillitis usually is viral and is a self-limiting condition. However, tonsillitis can also be bacterial, which means antibiotics are required to treat that condition. There are rare complications of tonsillitis, which I'm not going to talk about right now. However, on the National Health Service, we are now, the guidelines state that in order for a child to be referred across by the general practitioner to the tertiary referral center or secondary referral center for surgery, they've got to have 7 episodes of tonsillitis in 1 calendar year.
Wow.
5 episodes in 2 consecutive calendar year, or 3 or more episodes in 3 consecutive calendar years, which have to be documented at the general practice or by the GP, GP surgery, to confirm that these have been tonsillitis, or they should have had a throat swab done.
Right, okay. Now, I'm a little bit more wary of tonsillitis. It can make individuals feel rather poorly as well, especially your patients. Now, what you're trying to say is that the guidance says that if you have 7 documented episodes of tonsillitis within a year that's been documented by the GP on their system, which means that from our perspective, it has to be what we call coded, a coded
Correct.
diagnosis.
Yes.
And if it's a coded diagnosis, you are then, for over 7 episodes throughout the year, you are then eligible to be referred to an ear, nose, throat surgeon such as yourself for consideration of removal of the tonsils.
Yes, unless and until your patient also is known to have sleep apnea,
Aha.
or if they've had quinsy, which is presence of pus or abscess around the tonsils, for which usually hospital admission is required.
Okay. And is this criteria confined or restricted within Cambridgeshire only, or is it UK-wide?
It's national.
It's national
These
guidance.
are national guidelines, but I'll remind you these are guidelines.
Okay.
However, Unfortunately, a lot of CCGs have used these guidelines as a very strict criteria. And actually, within our region of Peterborough and Cambridgeshire CCG, there is a proforma that the general practitioners have to fill out, confirming the facts that I've just stated prior to referral. And if those facts are not stated in the referral letter, the proforma is not accompanied with the referral, our hands are tied. We agree with the parents, we agree with the patient, we agree that they warrant surgery. However, we can't, because the CCG, the way they work, they have restricted us, our decision-making privileges, simply on the basis of the strict criteria that they use.
Okay.
However, we are allowed to request for to organize an individual funding application, but that takes time, and a lot of time it's refused.
Okay. And just to make patients or listeners aware that this funding application, because we are going to go on a little bit without sort of causing any controversy, of course, that the CCG, listeners, within Peterborough and Cambridgeshire is a body that is responsible for providing NHS services both with your GPs and both at the hospital as well. They have a budget that is allocated to them from the central government, and it's on the basis of that budget that they can either look at giving you services, or if they see that they don't have the money from central government, in many cases, some CCGs in the country have to take the step of cutting services. And sometimes this isn't welcomed by patients, and we can understand why. Now, Cambridge and Peterborough CCG at the moment is embarking on a cuts to service campaign whereby we know that £33 million worth of cuts are going to take place to services. And in that, it's come to the public's attention that perhaps tonsillectomy or having a tonsillectomy on the NHS is going to now be slashed. Do you have any extra information about that?
I have no information about that. In fact, I was with the South Lincolnshire CCG last week, and this wasn't discussed. So, in all honesty, you probably know more than I do. I actually have no information on this at all.
Okay, thank you. Going back to you informing our listeners that tonsillitis is actually a viral infection that is self-limiting. A viral infection meaning that it doesn't need antibiotics, because antibiotics treat bacterial infections.
Correct.
Now, from a GP's perspective, we're often guided to use something known as a fever pain score. And within that, it predicts the probability of somebody having symptoms of a sore throat that could be bacterial and thus would require antibiotics. Now, the fever pain score, would you like to talk a little bit about it, or where we can decide as clinicians that tonsillitis would require antibiotics?
So, in all honesty, we usually get to see these patients when their acute period has settled. So we don't normally use the fever pain score. If they are admitted, if they come to the emergency department, then the criteria that we use for admission is if the patient has got high degree temperature, which is expected, and is actually not managing to eat and drink.
Yeah.
And then we are worried that they'll be dehydrated. Though that is our indication in the hospital that we use to admit these patients. From the perspective of, from the point of view which you have said, antibiotic prescription, if they've got very high temperature, then that is suggestive of a viral infection, and that usually settles. However, if the temperature is of the slightly lower lingering level, great. Then in that case, an antibiotic is advisable. Or if they've got palpable glands in the neck, then again, antibiotic is advisable. And that's the reason a lot of surgeries do a throat swab to get a culture result to see if they've got any bacteria growing, and then treat them appropriately with the correct antibiotics. Because the counter argument of this is developing antibiotic resistance if prescribed inappropriately, which means it does not serve the purpose, i.e. it's not going to treat the infection that the patient has, yet the patient may become resistant the bugs in the body may become resistant if the patient actually develops an infection in future where antibiotic is required. So that is the catch-22, which we have to be very careful and ensure that the antibiotics are used in a very judicious manner rather than being used on as and when required basis.
It's really quite interesting what you say, Mr. Qayyum. And the reason why I say that is, as a general practitioner, we're always told to be aware of signs of sepsis as well. So I did my sepsis training last week, in which we were given parameters on which to predict an individual's risk of developing sepsis. And as you know, sepsis can be a killer as well, a threat to life, for which immediate hospital admission is advised. In terms of what you've just described, yes, you're right, it is a catch-22 situation whereby we are wary of the sensible use of giving antibiotics or prescribing so that antibiotic resistance isn't developed. I often struggle trying to communicate that aspect to patients. So there have been times where I'm faced with someone who, for them, having an episode of tonsillitis makes them feel quite poorly, and you do an adequate examination. They've got a temperature, but it's not too high. You can see that the tonsils are inflamed, but you can't see any pus on them. Likewise, glands may or may not be raised, but they feel miserable. And the first thing that I often get told is, but I know that I am going to get better with antibiotics. I know my body.
They would get better anyways, with or without antibiotics.
How do you convince a patient that would think otherwise? It's difficult, isn't it?
It's very difficult. I can imagine it is very difficult. Fortunately, we as ENT specialists in the hospital are not faced with that situation, because you've sorted that out for us.
Like we sort out quite a lot for you as well.
So when they come to us, we know they only need surgery, and that's the bottom line.
Yeah.
But I would definitely reiterate to your listeners that they should listen to their GPs. And when the GPs, because GPs themselves are there to look after their patients. And no GP knowingly would ever undertreat any patient, because their own license and registration is at risk, and nobody wants to risk their own license or registration by inadequately treating a patient. So we all have patients' best interest at heart, whether we are in primary care, secondary care, tertiary care.
Very good insight, and thank you for giving that perspective, because I find it very helpful. Now, if you've just joined and tuned in, this is the Body, Health and Mind show with myself, Dr Shabina Asad Qayyum. I'm a local GP, and I also host the health show on our wonderful community radio station. And I have with me Mr Asad Qayyum, who's an ear, nose, throat consultant and the training programme director for the North West Anglia Foundation Trust. And we've been talking a little bit about common ear, nose, throat problems. So if you've got any questions at all, don't hesitate in messaging us on 07745278978. But we do have some comments which I'd like to share with you here, Mr Qayyum. And first of all, we have a brother from Amara Food Store and Halal Meat, one of our very regular listeners who's wonderful. He says, and it's not related to tonsillitis, but he says, do you think daily tablets is the only solution for hay fever, or any permanent solution for hay fever? It looks like our brother here is suffering from it. What advice do you have for him?
So for hay fever, oral antihistamine tablets, which are daily tablets, are always helpful. Along with that, I suggest that they should use, there are nasal sprays which are available for hay fever, which have a very low dose of steroid in them, which does not generally get absorbed in the system because they're only taken for a very limited period of time. That is locally very helpful in the nose and around the eyes, through the nose, through the nervous reflex mechanism, to reduce the sneezing fits, nasal blockage, runny nose, and watery and itchy eyes. So that's the second thing which is helpful. And if they don't want to use any of this, then yes, they will have some symptoms of hay fever. However, along with that, what they can do is some regular washing the nose, salt water douching we call it, nasal flushing, and regular washing of the nose actually helps in physically cleansing the nasal cavity and debriding the nose of all the allergens which can give rise to hay fever. So these are the three very common ways that can be adopted to help reduce the symptoms of hay fever. Along with that, if individuals are allergic to grass, not pollen but grass, there is a tablet which has to be given by a specialist, which is an immune modulatory tablet, which means it reduces the response of the immune system to suppress the symptoms of allergies caused by grass.
Right. Okay. Now, we would advise our listeners, I always have what we call a disclaimer that we announce at the beginning of the show, that any treatment that you hear of from here, it's a good idea to go back to your general practitioner to gain some advice, or indeed if you're under the care of an ear, nose, throat specialist, to gain some advice before you embark upon any treatment, because every case is individual. So we accept no responsibility for anybody who goes from here and starts taking these medications themselves.
That's why I've given a spectrum of treatment. I haven't spoken about one specific treatment, because specific treatment are tailored to specific requirements depending on what the patient's individual needs are.
Right, okay. Well, thank you for that. I've got a second question. I've got another sister who's asked. So we have Dr. Khalid Qureshi, who is also come on my show as a guest, and he has an absolute, what we call, wicked sense of humour, who says, not very long ago, when I was 12, I had a tonsillectomy. That was rather late, Dr. Khalid. You must have felt a lot of pain, because I always had a cold and runny nose, so he had allergic rhinitis. I can never recall having tonsillitis. Is that still an indication for the procedure?
I'm sure he must have made the ENT surgeon very happy.
Okay.
By having his tonsils removed. But if it's allergic rhinitis, the treatment of choice is treatment for allergic rhinitis, not tonsillectomy.
So there you go, Dr. Khalid. I hope that has given you some satisfaction. I will ask you a question personally, because this is something I get asked a lot. Now, I have a dear sister Ismat Nawaz. Salam, sister. I have a question. Sometimes doctors tells us we have tonsillitis and needs removing, but then we get lost in the system. How can we chase that? And what can we do with big tonsils that we actually see visibly? We have big snoring during sleep.
So, first of all, size of the tonsils is not of any concern.
Okay.
It's the frequency of infection which is the problem.
Right.
So, and the other thing I'd like to bring to your listeners' attention is that tonsillitis, infection within the tonsils, is actually a self-limiting condition. Mm-hmm. The infection eventually burns itself out. So bottom line remains, however, we don't know how long that will take. It can take 20 years, it can take 30 years, it can take 2 years. So and that's the reason why we remove the tonsils, or advocate removing the tonsils if an individual has had X number of episodes of tonsillitis per calendar year. However, as far as snoring is concerned, there are multiple. Number one, adults snore, children snore. Simple snoring is not a problem at all. And as far as snoring is concerned, in the spectrum of snoring, size of the tonsils is only one of the factors which can affect snoring. There are lots of multiple factors which can give rise to snoring, and tonsillar size is one of them, but not the only factor.
Okay, I understand. Now, Sister Ismat has also said that if you get lost in the system because your GP may have referred you for a tonsillectomy and you haven't heard from the hospital, how can we chase that?
So, first of all, it's important for the patient to ensure that the referral has actually left the GP surgery. And you can always do that by asking your GP's, the receptionist at the GP, to provide you with a copy of that referral letter.
Sure.
If you have a referral letter, you can always call up the department or the ENT department, informing them that on such and such date a referral was generated and they haven't heard anything back. Can they expedite? And if still they don't have any luck, they can always email the PALS PALS, the Patient Advisory and Liaison Service at the Trust, with a copy of the referral letter to inform them that a referral has been generated but an appointment hasn't come through. Can they kindly expedite? And almost always things will happen which unfortunately are unavoidable. However, if it's brought to the hospital's attention, an appointment will always come through.
Thank you very much for that. So, Sister Ismat, I hope that satisfied your question with the advice that Mr Qayyum has given. We have a very heartening comment here from Mr Ansar Hussain that I'd like to share with you. Assalamu alaikum. Great to see wonderful individuals giving advice on health. Both are health professionals, and how amazing to have one host the programme, mashallah.
Thank you very much.
Thank
very
you very
kind
much.
of you.
Thank you, Mr Hussain. It's wonderful. Now, Brother Khalid has got back to us. Dr Khalid, I think it was the trend in the 80s. Well, let me tell you one thing, Dr Khalid. I didn't have my tonsils out. No, that was a thyroglossal cyst. My brother had his tonsils out in the 80s. And unfortunately, my symptoms are still persistent. And I have probably helped pharmaceutical companies build many palaces by the amounts that I have spent on antihistamines. Dr Khalid.
I'd like to advise Dr Khalid, he should have bought shares in those companies before buying the medicine.
And Dr Khalid, the other thing is, I think the back of my advice is that I think you need to see an ear, nose, throat surgeon. So hopefully we can get on top of that. But do follow the advice that Mr Qayyum has given about trying to wash out the allergens from the nose by doing saline nasal douching. That avoids the need to take medications. And also, not many of you will know that I worked under Mr Qayyum for a while as his trainee, and one of the points that you actually taught me was to smear Vaseline on your eyelashes and on the inner aspect of the nostrils. So that's something that we could share because it traps the pollen, doesn't it?
It does, particularly at night when you go to bed, and that helps in physically forming a barrier as well. So that is always very helpful.
Okay, so that's a really good piece of advice as well. So we are approaching an advert, just to make listeners aware that after the advert for 4 minutes, we will also proceed, inshallah, to the azan. So we will come back, hopefully, within 8 minutes after the advert break and the azan break. But until then, it's wonderful to have you here on board. We'll talk a little bit about obstructive sleep apnea after this. So listeners, don't go away. We want you here, glued to us and tuned in, inshallah, after the break.
Stay tuned to Salam Radio after this short ad break.
कोई रत्तियां कमीज़ानी लमाना मारे मामा मिठियां में चीज़ानी।
मेरा नाम मुकद्दस है और कोट मेरा घर है और ये मेरे लिए किसी जन्नत से कम नहीं। हमारे भी कुछ ख्वाब हैं जिनकी ताबीर को हमें पाना है।
आइए इन बच्चों के ताबनाक मुस्तकबिल के लिए अपना हिस्सा डालिए। अपनी ज़कात, सदकात, खैरात और इमदाद कोट को दीजिए।
UK number 0300 123 7774. Website court.org.uk.
Peterborough just got a whole lot tastier. Five Lads Flame Grilled Peri Peri Chicken is now open. Bring your family and friends to Peterborough's first HMC meat selling restaurant. We are experts in grilled chicken, lamb chops and gourmet lamb and beef burgers. Our healthy options include fresh salads and fresh grilled vegetables. Fresh, clean and healthy grilled food with 4 different flavours. Lemon and herb, medium, hot and extra hot. 5-star hygiene rating. Eat in, order and collect or order for delivery on Deliveroo. Follow 5 Lads Peterborough on Facebook and Instagram 5 Lads. 15 Cowgate, Peterborough, PE1 1LZ. Call 01733 56 22 87. Open 7 days a week, 12 to 11 p.m.
Almarad Tiles. With over 70 stores nationwide, we are now open in Peterborough. Up to 50% discount offers now on. Largest selection of tiles. Full bathroom suites from only £189. Paint, LED lighting, laminate flooring from only £7.99. Over 1,000 designs of wallpaper in stock. We have everything you need. Come and visit us at 193 Fengate, Peterborough, PE1 5BH, or call us on 01733 34 58 47. Almorad Tiles, now open.
Had a car accident or an accident at work? Accident specialists are experts in no-win, no-fee accident claims. Leave the hassle to us. Our multilingual settlement experts will manage the entire claims process on your behalf, with nothing to pay up front. We provide services such as credit hire, taxi vehicles, recovery, storage and much more. For full details on our range of services and a free consultation, call us on 01733 555 774 or visit our office at 249 Lincoln Road opposite the NatWest Bank. Accident Specialists. Start your successful claim today.
Insure 24/7 is a community-based insurance brokerage offering competitive premiums and a great service. Taxis, properties and businesses, we cover them all. Call us on 01733 856699 or visit our new office at 304 Lincoln Road. Insure 24/7. We've got you covered. Insure 24/7 is authorised and regulated by the Financial Conduct Authority.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. قال النبي صلى الله عليه وسلم إن الغضب يفسد الإيمان كما يفسد الصبر العسل. That anger ruins faith just like the aloe plant ruins honey.
You're listening to Salam Radio and it's now time for Maghrib Azan. This Azan is sponsored by UK Islamic Mission, serving humanity since 1962.
Allahu Akbar, Allahu Akbar, Allah. أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا
الله أكبر الله أكبر لا إله إلا الله
اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم وبارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد. اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته. اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. اللهم بك نحيا وبك نموت وإليك المصير. رضينا بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم.
This Azan is sponsored by UK Islamic Mission, serving humanity since 1962.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum and welcome back to this informative, packed show, the Body, Health and Mind show, with the one and only Dr Shabina Asad Qayyum. I like to say that, on the one and only Salam Radio. And you know, at this stage, I'd really like to give a massive shout out to our wonderful new station manager, Sister Michelle, who is with us. And honestly, she's come in and she's helped us so much, and everything seems so much more. She's quirky, she's brought new ideas to the station, the adverts look amazing, so thank you very much, and please all join me in wishing her all the best, because we all know that we've got an extended Salam Radio family. There she's waving, I'm waving back as well. She's absolutely wonderful. So yes, a part of and a valuable member of the Salam Radio family, and it's the show's actually going very well. We've had a lot of input and a lot of interest, and please tune into this because there are so many interesting conversations coming about. I have Mr Asad Qayyum, who's a consultant ear, nose, throat surgeon for the North West Anglia Foundation Trust and also the training program director. We have some heartening messages from Brother Abdul Aziz Chaudhry, who has said, God bless you both, sister, brilliant information, and God bless you, Brother Asad Qayyum and Dr Shabina. Jazakallah khair.
Thank you very much. Thank you.
Ms Chaudhry, that's wonderful
Allah
of you to
bless
say.
as well,
Very
and your
generous.
family.
Thank you. And now I have Sister Salma Latif, and I'm hoping that we could talk a little bit more about ENT problems. We'll just go through the questions because there are listeners that actually want to ask something, which means this show is important to them, which is great. Now, Sister Salma Latif says, my daughter breathes very heavily and sometimes makes a whistling noise from her nose. She does suffer from severe hay fever and also has moderate deafness and wears hearing aids. Any help or guidance would be very much appreciated.
Thank you, Sister Salma. I'll try to advise to the best of of my knowledge based on the question that you have posed me. I would suggest heavy breathing is not a source of any concern, and I've said this earlier on in the show as well. However, if the child stops breathing, that is a source of concern, and it's advisable that you should make a recording of that episode on your telephone if it has happening frequently during night on regular basis, and take it to your GP, who will then refer you across to an ENT specialist because that warrants a referral. Whistling through the nose is suggestive of the fact that this child has got a blocked nose at night when they are asleep, which means that they probably would require a use of a topical steroid nasal spray or steroid-based nasal drops to counter the effects of allergies, which actually allows the nose to be which allows the child to breathe freely from their nose. With reference to the hearing loss, if you were in front of me, I would have asked you more questions. But from the fact that the child wears hearing aid means that the nerve of hearing is actually weak, and that is the reason hearing aids have been provided to this child. Unfortunately, there are some genetic conditions or familial symptom conditions or syndromes where the hearing is lower than the normal average normal population, and hearing aid is the treatment of choice. But I can assure you that allergic rhinosinusitis, heavy breathing and hearing loss with the weak nerve of hearing do not have direct correlation.
Right. So, Sister Salma, I hope that has helped you to some extent in trying to understand. Obviously, I'm sure that your daughter is having regular follow-up with the audiology department, and accordingly they will be able to monitor how her hearing is progressing and if the hearing aids are catering to the extent of hearing loss that she has, or if there's any further improvement that would be needed. And indeed, audiology departments are able to refer over to ear, nose, throat consultants.
Always.
Yes?
Always.
If there are any problems at all. So if there are any problems, do make your daughter make you aware, actually. Do ask her to make you aware of any problems that tend to surface, and then you can follow it up from there with her audiologist.
Similarly, if you have continuing problems with reference to her nose and breathing, you can always tell the audiologist that you have those concerns, and depending on what the current criteria is for the CCG, they may be able to refer you directly or may ask you to see your GP and then get your GP to generate a referral across.
Okay. Well, thank you very much for that input and for answering the questions that have been brought forward by our listeners, Mr. Qayyum. Now, on the same subject of talking about throat problems, we can talk a little bit more about obstructive sleep apnea, which is otherwise known as snoring. Before I go on to that, actually, I'd like to ask you a question. Having recurrent tonsillitis or adenoids, which is something else, and having breathing difficulties with snoring, and if there is something known as obstructive sleep apnea, what is obstructive sleep apnea for our listeners' information in layman's terms, please?
So snoring is simple snoring, where an individual's breathing is noisy at night when they're asleep, or during the daytime when they're asleep.
Right.
Obstructive sleep apnea is when not only that the breathing is noisy when they're asleep, but actually the breathing activity stops. We call it respiratory pauses.
Right.
When this cycle of breathing stops for a few seconds or up to a minute, and if it starts to happen on regular basis, then that is known as obstructive sleep apnea.
Okay.
This can be a permanent issue or it can be a temporary issue. So children who have whose tonsils are larger than those of adults and the throats are smaller because of their size, if they develop episodes of tonsillitis or a head cold when the nose gets blocked and adenoidal tissue gets inflamed, they can get temporary periods of obstructive sleep apnea where they stop breathing. But once they're out of the infective period, everything returns back to normality.
Right.
That is a temporary sleep apnea.
Okay.
However, on the other hand, there may be patients who will develop...
I'm sorry to interrupt you there, Mr. Qayyum. We have a phone call, and it seems like I'm going to just put our listener who is here online, and we have Mr. Hussein from Milton Keynes. Assalamu alaikum, Mr. Hussein.
Walaikum salam, Dr Shabina and Dr Qayyum. Both are doing a wonderful job, really, serving the nation, really, and giving us insight. I could have asked you this question in private, but I think it's probably good to ask it live on the show so others can benefit. To the consultant there, really, my wife's been suffering from this sneezing allergy for a number of years, and now for several years she's on this prescription where the GP has prescribed Montesquilat and Loratadine, and she that kind of helps it, eases the allergy. Now, my GP could have probably answered this, but I want to, because Dr Qayyum is an expert as well, so to have his feedback on long-term use of this medicine. Is there any kind of side effects, or when she stops using it, obviously the sneezing and the allergy comes back, so it helps her. So is it okay to use it continuously?
Okay. Montelukast.
So has she also been advised, Mr. Hussain, about any nose spray that she should be using?
Yes, I think it's is it Fluxinase?
Fluticasone.
That's the one. Yeah, she uses that also, and like I think you advised a bit earlier about using to put some kind of Vaseline around the edges, so kind of it creates a barrier. She's had some tests as well previously, but nothing really materialized from that, so this is what she's on now. So I just wanted to know whether for the long term is this okay, or what other kind of options do we have?
So she has had an allergy test done, which did not reveal what she's allergic to. Is that correct?
That's right, yes. They couldn't really pinpoint. I think what they said was it could be, there's a possibility in terms of any dairy products that may be causing it, but there wasn't kind of any concrete kind of comeback on that.
And was this test that she had a blood test, or where they did some needle pricks on the arm?
I think it was needle pricks, if I can remember. And she's going back a good few years. So if my memory serves me correctly, I think it was the needle prick.
So answer to your first question, no, there is not a problem. There are no serious side effects of being on these medications for a long period of time. Having said that, it's probably the treatment for allergy is twofold. Number one is allergen avoidance. And number two is medication to counter the effects of allergies. So it is probably a good idea to ask your GP to do a blood test if they can, which they usually can, to identify which specific substance she might be allergic to of the common ones around. If you're able to pick that up, then avoiding that is the first step to help improve her general symptoms. If you fail to get to the bottom of that, then and there are certain things like grass or pollen which are seasonal and we can't avoid, or house dust mite which we can't avoid, but we can reduce the exposure. Then those things will help improve her symptoms, and certainly and surely I can assure you that fluticasone, there is enough ample evidence in the literature, and loratadine, she can use it for a foreseeable future. Without any side effects. It may be an idea to avoid them for a short period of time, and then start using them again. If you look in the online, you will come across some very rare or very uncommon side effects, and those uncommon and rare side effects are there with essentially with all medications that an individual takes. But if she does come across some rare side effects like palpitations or feeling depressed or tremors or swelling in any part of the body or the oral cavity, then I would suggest that it's best advised to get in touch with your GP.
Sure, yeah. Just thank you for that. Really appreciate that. That's very, very positive and very good information you gave me there. Yeah, I think it's mainly, like pollen and stuff when, with that, and that's really, I think that is the primary kind of aspect where what triggers this really, rather than anything else. But you said have a blood test.
Yes, that's correct.
Is it blood test? Yeah, right. Okay, brilliant. Jazakallah. Thank you very much, Dr. Qayyum.
Thank you very much.
Thank you.
Thank you, Mr. Hussain. Thank you for your support. Assalamu alaikum.
Thank you.
Assalamu alaikum.
So, Dr. Shabina, I'll go back to the first question. I was talking about obstructive sleep apnea, and what I mentioned was that as this inflammation of the tonsils settles, the temporary obstruction of this breathing gets better,
right,
and they settle. However, if this continues for a prolonged period of time, this can have effects on the heart and other parts of the body.
Right.
So in those conditions, it's important that the patient should seek help from the GPs.
And when you say effects on the heart, Mr. Qayyum, what type of effects are we talking about?
So the heart is divided into 4 chambers, and they're divided into right and left. And it's usually the left side of the heart which has to work harder, because it's pumping blood against an area which is obstructing, and they can develop increased size of the left side of the heart, and on rare occasions heart failure as well.
Right, okay. Well, that's really interesting, because it's often these problems start from childhood in some cases, don't they? And also in adults, I've seen quite a considerable amount of obstructive sleep apnea. In your daily practice, would you attribute obstructive sleep apnea as being a more adult problem as opposed to a child problem, or?
It's a mixed bag. In adults, the commonest cause is increased weight.
Right.
If their weight is higher than a BMI, which is the height to weight ratio or a body mass index of 30, then they're at a very high risk of, then they are at, and then if they have sleep apnea, they need to lose their weight before any other surgical treatment can be instituted.
Right. Well, it does sort of make sense. And obviously, obesity is a growing problem within the United Kingdom, and the implications of obesity are many, and having an ENT problem such as obstructive sleep apnea is one of them. So we have Mr. Ans Hussain, who was calling from Milton Keynes, which was wonderful. Very honoured to have a listener from so far afield who has said, thank you for the advice, Dr. Qayyum and Dr. Shabina.
Most welcome.
Jazakallah. And we have Dr. Azur Chaudhry, a great colleague of mine, the best GP in Peterborough, I would say. He says, Assalamu alaikum.
Assalamu alaikum. It's very nice to have you here.
And great show as well. So thank you very much for that, Dr. Azur Chaudhry, for giving your kind comments. And any role, he's asking us a pertinent question. So you've spoken about obstructive sleep apnea. I know that you do snoring surgery. Again, it's one of those operations that possibly may be subjected to cuts in the CCG as well. And Dr. Chaudhry is asking, is there any role of uvuloplasty in snoring if it's enlarged? So speaking about the uvula, if it's enlarged, which is the dangly bit at the back of your throat, listeners, for those that don't know.
So uvula is, if you open a mouth and look in the mirror, the thing that dangles in the middle is known as uvula. So Dr. Chaudhry, indeed, uvulopalatoplasty in combination with tonsillectomy definitely helps improve snoring, certainly. However, before we go down that route, we have to ensure that the patient's nasal airway is patent. We also have to ensure that the patient's weight is within the ideal limit, because if they're overweight and we do an operation, it will not be successful.
Right.
So I always tell my patients that snoring is a multifactorial problem. And having said that, there is no one treatment for snoring, and also there is no treatment which will 100% get rid of snoring as well.
Okay. Dr. Chaudhry, I hope that that's answered your question. We have Councillor Amjad Iqbal who's come on board, who's saying great show. Thank you very much, Councillor Amjad Iqbal.
Thank you for your compliments, Councillor Iqbal. And Dr. Shabina, I'd like to bring to your attention that from the CCG's perspective, pretty much all over the UK, surgery for simple snoring is not funded anymore. And hasn't been funded for many years now.
Okay.
However, if an individual has got proven obstructive sleep apnea and where the sleep specialist recommends surgery, that is when we can get funding for it sorted out. Otherwise, it's not.
I see. So, Dr. Chaudhry, I hope that has in some way given you the answers that you were looking for. Now, in terms of, and I have to ask you the questions because my heart goes out to people who I see are placed on a CPAP machine. A CPAP machine helps with the adequate delivery of oxygen to the lungs if they suffer from obstructive sleep apnea. How on earth can somebody sleep with that noisy machine? That's the first question I would like to ask you.
They're so tired that they fall asleep.
But nobody else in the household can fall asleep.
They were not, the people around them were not able to fall asleep even before because of their snoring.
Okay.
So it's one of those things. However, these individuals are not a risk or threat to people around them, especially if they're professional drivers, if we are able to provide them once they have their CPAP machine.
Okay.
For individuals who suffer from obstructive sleep apnea, these are the recommendations from a lot of their employing organizations.
I see. That's very interesting,
including
Mr.
DVLA.
That's very interesting. So it's true when you send an individual for sleep studies. Would you like to talk a little bit just at the close, because time has passed, it's so quick. What is a sleep study? What does it entail?
So sleep study entails a formal proper sleep study entails an individual going and sleeping in a lab, in a laboratory. We call it a laboratory. It's a room with a bed. And the individual is stuck to different monitors or different leads, including a video being made of them whilst they're asleep with infrared camera. They have got a lead which measures their blood pressure, their heart rate, the brain activity, the movement of the chest, the movement of the abdomen, the pressure within the gullet, lots of variable factors, about 12 different factors. And on the basis of that, they're able to assess what is the level of obstruction. Some forms of obstruction are treated by surgery, however, not all.
Oh.
And if the obstruction is at the level of the tonsils and the throat or the nose, it is treated surgically. However, if the obstruction is because the side wall of the throat is collapsing in, that requires a CPAP machine which mechanically puts pressure on the inside of the oral cavity and the throat like a balloon to keep it open so the individual can then breathe oxygen in and out whilst they're asleep.
Okay. Well, that definitely does make sense. We have Brother Ibrar Razak, a wonderful pharmacist here in Peterborough, who said, great show, Sister Shabina Asad Qayyum. Thank you very much, Brother Ibrar. And I think that with all the information that you've given, and time is obviously very, very short, it's been a great insight into some of these respiratory problems. I have to say, however, that if I were referred for a sleep study, I don't think I'd be able to sleep in a laboratory environment. To be very honest, I need my own bed.
So that is the reason that sentence in itself is an indicator that you don't have sleep apnea.
Yes, that's right.
Because if you would have sleep apnea, you will find these individuals falling asleep anywhere and everywhere.
Right.
So for them to fall asleep in a lab or even in severe cases, cars parked on a traffic light is an indication that they need to have the sleep study done.
Thank you very much for that. Now, we're going to close this show. We've had some wonderful comments. We have Sister Shazia Iqbal. Salam, guys. Great show. Sakina, our little friend, says hi. Assalamu
Hello,
alaikum.
Sakina.
Hello,
Assalamu alaikum.
Sakina. Assalamu alaikum. And Brother Khalid Qureshi. Again, thank you for the useful information and God bless you both. On a lighter note, I'm now convinced that the Desi method of putting a chappal by the head doesn't treat snoring. And Dr. Imran Kangro, mashallah, great topic covered. Thank you so much, everybody, for listening in. And Mr. Qayyum, thank you so much for your time. We've had a fabulous show with some wonderful engagement. And hopefully, inshallah, no doubt, we shall be using your valuable time again, away from your very busy job, to gain a bit of insight onto your expertise.
Thank you and assalamu alaikum to your listeners.
Thank you very much, listeners. Hopefully, inshallah, next week for another Body, Health and Mind show. Assalamu alaikum.
Stay tuned to Salam Radio after this short ad break.
The masjid is a center of spirituality, education, and a social hub for the community. In the times of the Blessed Prophet, peace and blessings be